Introduction. Welcome to today's discussion on intestinal ischemia, a serious condition affecting the digestive system. Intestinal ischemia occurs when the blood supply to the small intestine is reduced or blocked, depriving it of essential oxygen and nutrients. This can lead to significant damage, even life-threatening complications if left untreated. In this video, we'll explore the causes, symptoms, diagnosis, and treatment of this critical illness. Etiology. Causes. Intestinal ischemia arises from various factors that impede blood flow to the intestines. The most common cause is atherosclerosis, or hardening of the arteries, where plaque buildup narrows the mesenteric arteries. Other potential causes include blood clots, low blood pressure due to heart failure or shock, twisting of the bowel, hernias, and certain medications. Also, vascular conditions such as vasculitis can lead to intestinal ischemia. Conditions that increase the risk of blood clot formation, like atrial fibrillation, can also contribute to the problem. Pathophysiology. The pathophysiology of intestinal ischemia is a cascade of events triggered by reduced blood flow. When the intestines are deprived of oxygen, their cells become damaged and start to die. This cellular damage leads to inflammation and can weaken the intestinal wall. As the condition worsens, the intestinal lining may break down, allowing bacteria and toxins to leak into the abdominal cavity. This can result in peritonitis, a dangerous infection, and even septic shock, a life-threatening complication caused by widespread infection. Epidemiology. Intestinal ischemia is relatively rare, but its incidence increases with age. It is more commonly seen in individuals over 60 years of age, and those with pre-existing cardiovascular conditions are at a higher risk. While precise numbers vary, studies suggest that acute mesenteric ischemia affects around 5 to 15 people per 100,000 each year. The prevalence of chronic mesenteric ischemia is harder to define, but it is estimated to be significantly less common than acute cases. Signs and symptoms. The signs and symptoms of intestinal ischemia can vary depending on whether the condition is acute or chronic. Acute mesenteric ischemia often presents with sudden, severe abdominal pain that is out of proportion to the physical exam findings. Other symptoms include nausea, vomiting, diarrhea, and blood in the stool. Chronic mesenteric ischemia, on the other hand, typically causes abdominal pain after eating, weight loss due to fear of eating, and changes in bowel habits. It's crucial to seek immediate medical attention if you experience sudden, severe abdominal pain, especially if you have risk factors for vascular disease. A diagnosis. Diagnosing intestinal ischemia requires a combination of clinical evaluation and imaging studies. A physical examination, review of medical history, and blood tests are usually the first steps. Elevated white blood cell counts and lactate levels in the blood may suggest intestinal damage. The gold standard for diagnosis is angiography, which involves injecting a contrast dye into the arteries and taking X-rays to visualize blood flow. Computed tomography. Angiography is also frequently used as it is non-invasive and provides detailed images of the mesenteric vessels. In some cases, exploratory surgery may be necessary to confirm the diagnosis. Classifications. Type I. Intestinal ischemia is generally classified into two main types: acute and chronic. Acute mesenteric ischemia is a sudden blockage of blood flow to the intestines, requiring immediate medical intervention. It can be further divided into embolic, thrombotic, non-occlusive, and mesenteric venous thrombosis subtypes, each with distinct underlying mechanisms. Chronic mesenteric ischemia, also known as intestinal angina, develops gradually due to progressive narrowing of the mesenteric arteries. A third, less common type is ischemic colitis, which affects the large intestine and can be either acute or chronic. Treatment and management. Treatment for intestinal ischemia depends on the severity and underlying cause. Acute mesenteric ischemia often requires emergency surgery to restore blood flow to the intestines. This may involve removing blood clots, bypassing blocked arteries, or resecting damaged sections of the bowel. Endovascular procedures such as angioplasty and stenting may be used to open up narrowed arteries. Chronic mesenteric ischemia can be managed with lifestyle modifications, medications to control risk factors, and revascularization procedures to improve blood flow. Broad-spectrum antibiotics are also typically administered to prevent or treat infections. Preventing intestinal ischemia focuses on managing risk factors for cardiovascular disease. This includes maintaining a healthy lifestyle with a balanced diet, regular exercise, and avoiding smoking. Controlling high blood pressure, high cholesterol, and diabetes is also essential. For individuals with a history of blood clots or vascular disease, medications such as antiplatelet agents or anticoagulants may be prescribed to reduce the risk of future events. Regular checkups with your doctor can help identify and manage risk factors early on. Prognosis. Recent research or advances. The prognosis for intestinal ischemia varies greatly depending on the promptness of diagnosis and treatment. as well as the severity of the condition. Early diagnosis and intervention significantly improve the chances of survival and recovery. However, delayed treatment can lead to severe complications and a higher risk of mortality. Recent research is focused on improving diagnostic techniques, developing less invasive treatment options, and identifying novel therapies to protect the intestines from ischemic damage. Areas of investigation include the use of biomarkers for early detection, advanced imaging modalities, and targeted drug therapies to reduce inflammation and promote tissue repair. Continuous advancements in medical knowledge and technology are improving the outcomes for individuals with intestinal ischemia.